This course describes the wrist region. The wrist joins the hand to the forearm and contains multiple bones and articulations that form a series of complex joints. The function of the wrist is to position the hand in relation to the forearm. The radius is one of the two bones of the forearm. Fracture of the radius most commonly occurs distally, near the wrist. A common mechanism for a distal radial fracture is a fall on an outstretched hand. The ulna is the larger and longer bone of the forearm. The radius and ulna both have small bony protrusions at their distal ends, named the radial styloid process and the ulnar styloid process. The distal radio-ulnar joint, or DRUJ, is the joint between the distal ulna and the distal radius. Injuries of the DRUJ occur frequently with distal radial fractures. The wrist contains 8 carpal bones that connect the hand to the forearm. The carpal bones can be conceptually organized in 2 transverse rows, the proximal carpal row and the distal carpal row. Within the proximal carpal row, each bone has a limited degree of independent movement. The scaphoid is the most commonly fractured of the carpal bones. This typically occurs due to a fall on an outstretched hand. The major blood supply to the scaphoid is via the dorsal carpal branch of the radial artery, which supplies approximately the proximal 80% of the scaphoid via retrograde blood flow. Therefore, fractures to the proximal and middle sections of the scaphoid carry a significant risk of causing avascular necrosis through disruption of this blood supply. The lunate is located in the center of the proximal row. The scapholunate ligament runs between the scaphoid and the lunate and is the most commonly injured carpal ligament. Tears to the scapholunate ligament can lead to the development of carpal instability and disabling arthritis. Therefore, surgery is often indicated to treat these injuries. The triquetrum lies between the lunate and the pisiform. The distal carpal bones have less intrinsic mobility compared to the proximal carpal bones. The distal carpal row comprises, most radially, the trapezium. In the middle, the trapezoid and the capitate. And most ulnar, the hamate. The wrist contains intrinsic ligaments and extrinsic ligaments, both palmar and dorsal. The intrinsic ligaments are short connections between the individual carpal bones that provide intercarpal stability. The extrinsic ligaments are longer connections between the carpal bones and the forearm. These ligaments primarily support the radiocarpal joint. The ulnocarpal and radioulnar ligaments also help support the wrist. The triangular fibrocartilage complex, TFCC, is a structure between the lunate, triquetrum, and ulnar head. The TFCC stabilizes the ulnar aspect of the wrist. A tear in the TFCC can occur due to compression of the wrist in ulnar deviation. The radiocarpal joint, known generically as the wrist joint, is formed by the articular surface of the distal radius and the proximal carpal row. The wrist joint allows movement in 2 axes, flexion, extension, and radial and ulnar deviation. Radio-ulnar articulation is responsible for movements of pronation and supination. The muscles and tendons that make up the wrist can broadly be grouped into flexors and extensors of the wrist, thumb, and fingers. The abductor pollicis longus, extensor pollicis longus, and extensor pollicis brevis all act to extend the thumb, with the abductor pollicis longus also providing thumb abduction at the carpometacarpal joint. De Quervain's tenosynovitis occurs when the tendons of the abductor pollicis longus and extensor pollicis longus become inflamed and swollen due to excessive physical effort of the thumb. This results in reduced movement and pain. The extensor carpi radialis longus, extensor carpi radialis brevis, and extensor digitorum contribute to extension of the wrist. Extensor digitorum acts mainly to extend the phalanges at the metacarpophalangeal joint. Extensor digiti minimi and extensor carpi ulnaris run through the dorsal wrist and contribute to wrist extension. Extensor digiti minimi also extends the fifth digit, and the extensor carpi ulnaris also adducts the wrist. The extensor retinaculum of the wrist is the broad, fibrous thickening located at the dorsal wrist. It keeps the extensor tendons aligned and it prevents bowstringing during movement. The flexor muscles run at the palmar aspect of the wrist. The flexor pollicis longus primarily flexes the thumb. The flexor digitorum profundus and the flexor digitorum superficialis perform flexion of the wrist and phalanges. The flexor retinaculum is a fibrous band that covers the carpal bones and tendons passing through the palmar aspect of the wrist, forming the carpal tunnel. The median nerve runs through the carpal tunnel to the hand. If this nerve becomes compressed at the level of the carpal tunnel, it manifests clinically as carpal tunnel syndrome. To treat this, it is sometimes necessary to surgically dissect the flexor retinaculum to release the pressure on the nerve. The flexor carpi radialis and flexor carpi ulnaris also contribute to flexion of the wrist and provide radial and ulnar deviation. Two major arteries pass through the wrist, the ulnar artery and the radial artery. The ulnar artery runs via the medial aspect of the forearm through the palmar aspect of the wrist to form the superficial palmar arch. Here it joins the radial artery running via the lateral aspect of the forearm. The radial and ulnar veins accompany the radial and ulnar arteries, respectively. Two veins generally run with each artery. The radial veins run via the lateral aspect of the arm, while the ulnar veins run at the medial aspect of the arm. The median antebrachial vein is a superficial vein that drains the superficial structures of the forearm and wrist between the basilic and cephalic veins. The cephalic vein is a superficial vein of the arm. It runs from the thumb to the elbow, where it communicates with the basilic vein via the median cubital vein. The cephalic vein is a common vein to use for intravenous catheterization near the elbow. Furthermore, the cephalic vein is used to create a radiocephalic arteriovenous fistula with the radial artery. When a fistula is created, both the artery and the vein dilate and elongate in response to the greater blood flow and shear stress, but the vein dilates more and becomes arterialized, making it suitable for regular hemodialysis. The forearm, wrist and hand are innervated by three nerves, the ulnar, median and radial nerves, all of which arise from the brachial plexus. These nerves provide extensive motor and sensory innervation. Here, only their actions on the wrist are described. The ulnar nerve passes through the palmar side of the wrist. It provides motor innervation to muscles that act to flex and adduct the wrist. It provides sensory innervation to the medial palmar skin and digits. The median nerve runs through the carpal tunnel at the wrist and provides motor innervation to muscles that act to flex and pronate the wrist, and provides sensory innervation to the lateral palm and lateral 3½ fingers of the palmar surface of the hand. The superficial branch of the radial nerve runs through the dorsolateral wrist to provide sensory innervation to the dorsal surfaces of the lateral hand and lateral 3½ digits. Proximally, the radial nerve provides motor innervation to the muscles of the posterior forearm, acting to extend and abduct the wrist and supinate the forearm.